So we're starting here in prone. I like to do two of the main tests for assessing ankle dorsiflexion here in prone. First, we're going to do the prone dorsiflexion test. So what we're going to do is we're going to take Crystal's legs and we're going to bring them up here to around 90 degrees of knee flexion. Now, not always, but sometimes what you might end up seeing is on the side that is typically less affected, you might see a very neutral foot position, neutral shin position, and sometimes, as I said, on the affected side, maybe they have an old knee injury or an old ankle injury. What we're going to find is you might see a little bit of tibial external rotation or their foot starting to point out in this position. Again, that's not always going to be the case, but just something you might see. In Crystal's situation here, she has a more larger history of right ankle sprains that still causes a bit of lingering stiffness on through her right side. So what I'm going to do is I'm just going to take Crystal up into dorsiflexion. This is her left ankle. I'm just going to grasp her foot just like this. Okay, so just grasping the foot in this position. And then all I'm going to do is pump her into some dorsiflexion. Typically what I like to do to start the test is just get a sense of how well does the ankle move in general. Are we getting motion at the talocrural joint? Are we getting a lot of motion through the foot? Sometimes you might feel, because we can feel things through our assessment, that there's a bit of stiffness here in the ankle, and then we get a lot of splaying through the foot. So some people might compensate through their stiff talocrural joint by getting a lot of foot motion. May not be a bad thing, but it's just something to note. So you're feeling that in your hands. Where is the motion coming from?